Hi, I'm Jessica. I'm a student physical therapist, and today we're going to be doing an assessment of the knee joint. I'm going to go over range of motion at the knee with flexion and extension, and then I'm going to do 2 muscle testing measurements with the quads and the hamstrings, and then I'm going to conclude with a muscle length test of the hamstrings. So first, to do flexion of the knee joint, we're going to use a goniometer, and I'm going to line up my axis with the lateral condyle of the femur. And my patient's going to start off being supine, laying on their back. So my axis, lateral condyle of the femur. My stationary arm is going to be lined up with the greater trochanter, so right there, along the longitudinal axis of the femur. My movable arm is going to be lined up with the lateral malleolus. I'm just going to raise this table so I don't hunch over and have good body mechanics. So I'm going to ask the patient to flex her knee as much as she can, bringing her heel to her butt. Awesome. And reline up my goniometer. Okay. So I'm getting a reading of 146. You can relax. And that's good. Normal is 135, so she has good range of motion in her knee for flexion. So for extension, I'm going to use some towels, same patient position, lying supine. I have one towel underneath the distal thigh, and the other towel underneath her ankle. Okay. For this one, same axes as before for flexion. It's going to be the lateral condyle of the femur. My movable arm, or stationary arm, is going to be lined up with the greater trochanter along the long axis of the femur. And then my movable arm is going to be lined up with the lateral malleolus. And I'm going to ask the patient to extend her knee as much as she can. Good. And I am getting a reading of 4. So 4 degrees. So normal extension of the knee joint is 0 to 10 degrees. So this would be a good range of motion for the knee. So you can move these towels. Okay, so next we're going to do muscle testing. We'll do the quads first, so I'll have my patient sit up and have her knees over the edge. And I'm going to have one hand underneath her distal thigh. I'm going to have her straighten out her knee to extension. I'm going to have her hold it there. That'd be a grade of a 3. And then I'm going to apply pressure to the distal tibia into flexion. So don't let me move you, okay? Hold, 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 hold. Good. That'd be a grade of a 5 because her knee didn't move. So you can relax. Now for hamstrings, for muscle testing, I'll have you lay on your stomach and prone. This will be a gross hamstring test. So I'm going to flex her knee to 90. I'm going to stabilize the distal thigh, and I'm going to apply pressure on the distal on the back of her ankle into extension. So hold right there. That'll be a 3. Good. Don't let me move you. Hold, 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 hold. Good. That'd be a grade of a 5. You can relax. Okay, so lastly, we're going to do muscle length test at the knee joint, and it will be the 90-90 test for the hamstrings. So you want to flip over on your back and supine. Okay. I'm going to raise the table a little bit. Okay, so first, we'll use a goniometer again. And first, I'll have the patient flex her hip to 90, and I'll ask her to hold it there for me while I line up the goniometer. It's going to be the same axes as before, the lateral condyle of the femur. My stationary arm is going to be lined up with her greater trochanter. And I'll ask the patient to hold that in place for me. And then I'm going to this is a passive test, I'm going to passively move her knee into extension until she can't go anymore. Line this up with the lateral malleolus. Okay, and I'm getting a reading of 36, you can relax. And normal would be 0 to 20 degrees, so at 36 degrees that shows that she has some hamstring tightness at the knee joint.